Hey everyone, Luke here with the Knee Replacement Therapist. In this episode of the Knee to Know Show, we're going to talk about why does knee replacement recovery and rehab take so long. Before I jump into that, be sure to hit the subscribe button and turn on the notifications to catch all of our latest videos. So what you first have to remember is a knee replacement surgery is in reality a trauma to the knee and to your body. You're cutting through all sorts of soft tissue, muscle, tendons, ligaments, and you're also cutting and reshaping the surface of the bone to then accept and have the new prosthetic components attached to them. So that's a lot of trauma and injury to your body and to your knee joint. And what you have to remember is the stages of healing takes a very long time. It can take many months, up to a year, over a year. So when we think of the different stages of healing, the first stage is this inflammation stage or acute inflammatory stage. This is the early stage where you have pain, swelling, redness, and your body's just focusing on kind of flushing out and getting rid of any of the damaged tissue, getting out any microbes or anything that's in there that shouldn't be in there, kind of flushing things out, cleaning things out, almost a little bit of an immune response. It's trying to prevent infection. That's part of inflammation's job, is to get cells and get things that shouldn't be there. This is the first 1 or 2 weeks of surgery, or after a trauma. This is where you have a lot of pain, you have a lot of swelling, you can't move very well, things are a little touch and go. Then we go into the second stage of tissue healing, is the proliferation stage. This is where you start to lay down and start to develop some of that scar tissue. It's very tensile, very strong, connective tissue, collagen fibers that are being laid down and being formed in this stage. So the body's focusing on repairing that damage and then building new tissue structures. That's about 2 weeks to 6 weeks approximately. From 6 weeks on to a year or over a year, year and a half, is the maturation and remodeling stage of tissue healing. Now this is a stage where there's reorganization of those collagen fibers. So the collagen fibers start to remodel, they start to align up, they start to mature, and this is really the end stage and the longest stage of the healing and recovery process. What you might think about is early on after surgery, those first 6 weeks or so, give or take, is when you're focusing a lot on restoring your range of motion, your bending, your straightening of the knee. And part of that is because that scar tissue is starting to form. And after about that 6 weeks, and this is approximation, that scar tissue is now formed and it's going to start realigning and repositioning. So that is one reason why restoring that range of motion in those first weeks after surgery is so important. But let's go back to the timeline of recovery from surgery. So your body, 6 months out, 1 year out or more, is still going through that last phase of tissue healing, maturation, remodeling, making these appropriate changes. So just based on that, that's just biology and physiology. We can't change that. We can't adjust that. We can't speed that up no matter what you see advertised or promoted in different things on television or online. In reality, we really can't speed that up, at least not any noteworthy extent. We just have to allow that to happen with your body. Now, of course, we're not just sedentary and not doing anything during this time. We're going through our rehab. We're building muscle strength. And that's another reason that recovery takes so long, is there's a significant decrease in muscle strength, muscle force production after surgery. And it takes many weeks of consistent exercise and strengthening to build back that strength. So what that's going to look like is functionally you're having issues with walking, stairs, you're having issues with getting up from a chair or a surface. Well, that's because your body is still building back that strength. So your body's going through the tissue healing process. Your body is building strength at a normal biological rate. It's building back up strength. You're dealing with pain and other issues. You might be someone who going into surgery, you have other comorbidities or medical factors. That's going to potentially lengthen and decrease the efficiency of your recovery. You might be someone who's a little bit older in age, or you might have some psychological factors, stress, anxiety, depression. That can really feed into negatively your rehab and recovery. So it can become a little bit of a vicious cycle of self-doubt, stress, anxiety, and that can really make it a challenge going through this prolonged rehab and recovery process. So what we want to think about is, one, get on your rehabilitation plan and follow that plan. Listen to your surgeon, your physical therapist, and stay consistent with what you should be doing in your phase of recovery. What you're doing early on, those first weeks, of course, are going to look a little bit different than what you're doing at 3 months out or 6 months out from surgery. So continue to have that open dialogue and communication with your physical therapist, with your surgeon and healthcare team. The other thing is just trying to maintain a healthy lifestyle overall, eating healthy, being physically active as much as you can, trying to get good sleep, trying your best to manage stress, both related to your rehab and maybe in other aspects of your life. There's a lot of different strategies and ways to do that, but being aware of it and being proactive will be beneficial in the long run. And setting realistic goals. Like I said at the beginning of this video, it's a marathon, not a sprint. You're going to make recovery. The vast majority of people have good outcomes in recovery, but just understand that it's not going to occur in those first couple weeks. It could take 6 months, it could take up to a year, or much longer. So set realistic goals and expectations with your healthcare providers, with your physical therapist, and they can help educate you and help you understand this a little bit more. And when you need help, seek that help and support. Again, it might be from your healthcare provider, it might be from a family member or a friend, or maybe some psychological support, speaking with a psychologist, a psychiatrist, getting professional help related to concerns of stress and anxiety of the rehab process. The rehab and recovery is not for wimps. It can be challenging, there can be obstacles, and it's a marathon and not a sprint. But most people, at the end of the day, by the time they're fully recovered and rehabbed, they feel like it was a positive thing to have a knee replacement surgery, and they're thankful that they had it. I hope you found this helpful and insightful. Please be sure to hit that like button, leave your comments and questions below. As always, thank you very much for watching.